Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. There's a new warning out about the growing dangers of superbugs. The British government says higher rates of drug-resistant infections could lead to 10 million deaths a year and cost $100 trillion. John, let's talk about the findings in this study. What are the main points this study makes?
Well, it was kind of a worst-case scenario. What happens if we continue on this current pace and things continue to get worse and worse and more bugs get more and more resistant? And by 2050, you could be talking about 10 million lives a year dying because of these bugs and a loss of GDP of 2 to 3.5%. And what's interesting is it's actually probably an underestimate because it's only a small number of bugs you're looking at. The greatest number of deaths probably accountable by malaria and the greatest drop in GDP by E. coli bacteria.
Wow. Well, I remember when we first heard the word superbug thinking this seems so novel, but now I feel like we're hearing this word again and again. So has the threat actually increased?
You know, the threat is going to increase exponentially, but it's here now. This isn't only something that we're thinking about for the future. You know, more than 2 million Americans every year end up with very, very serious illnesses related to this drug-resistant drug-resistant bacteria that can't be treated with antibiotics. Yeah. And there are 23,000 deaths just in the U.S. alone from superbugs. So, you know, this is something that is a direct result of the overprescription of antibiotics, both in medicine and the overuse of antibiotics in agriculture. Basically, new antibiotics aren't being developed at the same rate that bacteria are learning essentially to fight off the antibiotics we have. So it's about sort of focusing on getting new antibiotics out there before the bacteria win the battle.
John, just this week, Merck paid upwards of $8 billion to buy a company that has some promising new antibiotics. I mean, how do you solve this problem?
Well, the first step, I think, is what we're doing now is saying, hey, there's a problem. Yeah. Because I think even though there's been awareness, it hasn't been enough awareness. I mean, I think it's different fronts of this. One of it is just improving prevention by improving hygiene in developing countries, underdeveloped countries. The other is figuring out better ways of making diagnosis, looking at the genetic code of the bacteria, figuring out weaknesses, and finally new treatments, as Holly was saying. We have to just not do the traditional antibiotics. Think out of the box.
Right.
Well, also this week, sleep and your memory. A new study in the journal Neurology sounds the alarm on a possible connection between poor sleep and dementia. The researchers find that certain sleep disorders may put you at a higher risk. So, Holly, do they know what is the correlation between lack of sleep?
Right. Well, Vanita, this was a really interesting study. Researchers followed a group of elderly men and looked at their sleep habits. And then after these men died, they studied their brains to see exactly what the sleep habits, what sort of impact they had. They found that men who suffered from sleep apnea, that's when you have low levels of oxygen circulating in your blood at different times during your sleep, they were more likely to have something called microinfarcts, which are little areas of essentially dead brain cells. That's linked with dementia. And also people who don't get enough deep wave sleep. That's the really deep, slow wave sleep that we need. They're more likely to suffer both memory deficits and dementia as well. So it reminds us that fatigue isn't the only sign of not getting good sleep or enough sleep. Right. Memory loss is also a very important sign.
So John, can you treat these sleep problems and reverse the memory loss?
Well, there are treatments. There's a device called the CPAP device, continuous positive airway pressure device, which puts air, sort of forces it into you so that the oxygen level goes up while you sleep. Right. And there have been studies showing that your cognitive function can improve if you have a sleep disorder and you get this. Weight loss can help. But Holly was talking about the microinfarcts. Once it's happened, once the cells are dead, they're dead. Mm-hmm. So prevention is important. So if people do have any kind of issue, they should go certainly talk to a doctor if there's any problem.
All right. A large number of doctors who are listed as serving Medicaid patients are not available to treat them. In fact, a study just out by the Inspector General of Health and Human Services finds half of providers could not offer appointments to Americans on Medicaid.
There is a new warning about dangerous mixtures of prescription drugs. A report finds almost 60% of Americans who take opioid painkillers combine them with other prescription medications. That is a potentially deadly combination. Are there any pills that stand out?
You know, the group of drugs we're talking about mostly are opioid painkillers. Those are things like morphine, codeine, brand names like Percocet and Vicodin. The study was very interesting. It showed if you take any of these medicines for a period of time, or you take it on a regular basis, you're also likely mixing it with other drugs, specifically anti-anxiety drugs, we call those benzodiazepines, and muscle relaxants. The issue is the more you mix these drugs, the greater the risk of overdose. All of the drugs are sedating, and they act on different parts of the nervous system. So in tandem, you're really raising the dangerous effects.
Doctors have to be aware of this, John. Are patients just ignoring the warning?
I think some patients do ignore the warning, but I don't put it on them. I mean, they're desperate a lot of the times. They're in severe pain, and I think doctors have to get better at treating pain with things that are not necessarily just pills. There's acupuncture, there's all sorts of integrative medicine techniques, and I think right now I consult with pain experts because I realize I'm kind of out of my league a lot of the times when there's severe pain.
Mm-hmm.
Well, finally this week, hospital residents are known for extremely long duty hours, but in 2011, their work shifts were shortened under the theory that it would result in better outcomes for patients. Well, now a report in the Journal of the American Medical Association shows the reduced workload hasn't done much to change mortality or readmission rates for hospitalized patients or outcomes for general surgery patients. I have a feeling you both have horror stories about this, but are you surprised?
You know what, this doesn't surprise me at all. But I want to say, you know, right off the bat, the answer is not to increase the length of work shifts for doctors. You know, I think a lot of mistakes happen when one doctor, we call something called sign out, where one doctor's leaving and they sign out and give patient responsibility to another. Sometimes things get lost in translation there. But we shouldn't go back to the 36-hour shifts that you doze off, and that's not a good thing either.
Yeah, we just talked about what happens with sleep deprivation. You know, your cognitive function goes down. So the answer is not to work longer; it's to make these handoffs better. And maybe there are so many other causes of deaths in hospital that this is relatively a small part. You can't show it statistically.
How do you make those handoffs better? I mean, you'd think those would go pretty effectively.
You know, there are ways to do it by computer, and you know, and also just making lists and doing it sort of old school. But in the 4x400 race, where is the race loss? In the handoff of the baton.
So
you drop the baton.
So true.
Dr. Jon LaPook, Dr. Holly Phillips, thank you both so much.